Well, health-wise, it goes without saying, 2021 has been a very difficult year for all of us, but especially people succumbing to COVID-19 and their families. Over 90,000 people, as I mentioned, having lost their lives since COVID-19 was first detected in the country in March of last year. That's how long it's been going on. South Africa this year, let's see how far we've come as far as COVID-19 is concerned, joined by health expert Professor Salome Maswime joining us. Prof, good morning to you, and I suppose it is important for us to look back over the year as far as COVID-19 is concerned. Lessons learned, lessons we haven't learned. Where would you like to start? Lessons we've learned or lessons we haven't learned? Good morning, Prof.
Good morning. Thank you so much for having me this morning. And I think I'll start by just looking back and looking at in 2020 last year, a big focus was on health system strengthening, and most of us realizing that we were not fully prepared for the pandemic. But this year has been slightly different because this year the focus has been more on human behavior, looking at how we respond to healthcare. And some of the things that have struck us or that have come out quite clearly was initially in the beginning, there was the issue with the alcohol bans, and just seeing that as soon as the alcohol bans were stopped, there was a high surge in the numbers of trauma and casualty patients. There was also gender-based violence, and I think right now what we're facing mostly is vaccine hesitancy and the anti-vax. So it's been a lot around human behavior, community engagement, and trying to ensure that people understand why they need to do what they have to do.
I'm very confused. I'm actually glad I'm speaking to you about this. Tell me why you think this happened. Before we got the vaccinations, before we got the vaccines in the country, everybody was very angry that us here on the southern tip of Africa weren't getting vaccines. It was unfair. Europe was getting them before us. America was getting them before us. And now we just don't seem to be interested in getting the jabs, even though they are available. Why do we do that, do you think, as South Africa?
I think what we haven't paid enough attention to is human behavior science. And so I speak more as a global health expert, talking about issues of accessing care, that you can provide a service, you can provide something, but it doesn't mean that people are going to warm up to it. And so the issues around vaccine hesitancy has really highlighted how far are we going to engage with communities to ensure that they understand why they need to get the jab. You know, is our health system responsive to human needs, or is it merely about providing services? And I think those are the things that we need to think about as a healthcare sector.
When you say we need to think about it as a healthcare sector, how much do you think government thinks about this? The health department can only do so much. In the end, it's all of government that has to be involved in this as well. So health department, I'd like your ratings on them. How do you think they've done? And then compare that for me, Prof, if you could, with how government has been handling this. Because it does seem at times there was a disconnect, doesn't it?
Yes, definitely. I mean, I speak as an academic, as one who has worked extensively in the public health sector, but I do think that sometimes not all of us go to the ground and get involved with patients directly. A lot of the focus is on service delivery and what you can provide, and very little engagement with the community. I have participated in health engagement, in vaccine engagement, community engagement workshops, and you get to listen to the side of the patients and hear their fears, their concerns, and then are able to relay messages that are going to give them much more ease about the vaccine. So I think it's not just government, but it's partnership. As academics, as NGOs, a lot of us need to work together to reach the actual patients or the people that we want to utilize the services that we're providing.
Professor, allow me to be a little bit cheeky, if I can, and ask you our viewer question. Not sure if you heard it earlier. So curfew, a lot of people very angry, getting upset about the curfew. I don't think anybody really cared before we started getting to Christmas and New Year's. Now, because we have to leave our friends before midnight on New Year's, suddenly everyone's very upset about curfew. Would you drop the curfew? Would you lessen the hours of curfew? What's your view on the curfew, if you don't mind?
I mean, it's a very tricky one. And of course, I wouldn't, I want to speak as a medical expert and not so much relay my personal views. I think there is enough evidence, or there is evidence showing that the the curfew is important. It's important to ensure that people are not out, partying, spreading the virus. And so I think for that reason, I do understand those that are saying that we need to ensure that this, that we're not spreading the virus and spreading the disease and having super spreader events. Basically, that's what it's really meant to be doing on New Year's Eve. So we know with the past what happens around New Year's Eve. That's a time where everyone wants to go out, party, engage with others, and that's a very high-risk period. So I would look at it from the point of protecting the public. It's being put in place to protect the public. But the merits of whether it's how effective or ineffective it is, I won't go into that because that's not my real area of specialty.
I just wanted to get your thoughts. That's why I said I was being a little bit cheeky, Prof. Let's turn our attention back to vaccinations for a moment. Social media, always a very dangerous place to pick up on discussions, but one that I have been picking up on is this now, the third Pfizer jab, the booster shot, whichever term you'd like to use for it. A lot of critics, and I'm curious to see and to hear what you tell critics when they say, well, now we're getting a third shot. It's because the first two aren't working. I'm sure you've heard all these theories and conspiracy theories. Well, how do you tell someone who's against the third vaccine that this is the right thing to do? As you say, you've been at the coalface, you've been on the ground. I'm sure people have asked you these questions. How do you address that?
Yeah, so it's a very interesting one, or a very good question, because as we know, science, a lot of research has been done over the past 2 years, and I think South Africa has contributed massively to the research that's been done towards the pandemic, towards COVID. And so we're getting new information every day. And so it's important that we respond to science, but it's also important that science is communicated in a way that people will understand, in a way that people will see their personal benefit in all of this. So it is a difficult one because we're still struggling to get people just to take their first jab. And now to say go and get a third one is obviously going to need a lot of effort and work in trying to get people just to understand this. So it is a very tricky time, but I think that our governments, our academics, our healthcare workers need to rise up to the situation and need to put more effort in trying to get people to understand. I think that's the main thing that I want to say, that how we engage with our communities is very important. It's not just about providing a service, but it's about ensuring that people understand and see their benefit in all of this.
And Prof, let me leave this with you as my last question, if that's all the same to you. Christmas Day, the numbers didn't seem to be too high. I say that they're also knowing how low the testing was, so we've got to look at it in relation to the number of tests done. How worried are you about New Year's Eve and New Year's Day itself, considering what the beaches look like, etc.? It's my last question. How concerned are you?
Yes. So my concern is that because now people are seeing that the numbers are slowly coming down and they've seen the reduction, especially as you said, Christmas Day, etc., people might be more relaxed. And that also puts us in a more dangerous space, because the more relaxed we are about this, the more at risk we are of getting the disease, of spreading the disease. So I think that in general, we should all remain focused and aware that we're in a fourth wave, and that we shouldn't relax at this time, and let's at least get through this festive season, and then we can start reviewing our behavior and how we engage in things. So I would encourage that we don't relax completely now that we've seen what's happening over the past few days.
Well, Prof, I appreciate your time and wishing you all the best for your New Year's Eve celebrations, and 2022, I have no doubts we'll talk again in the coming days. What a pleasure to have Professor Salome Maswime joining us, clinical and health expert here on eNCA.